Welcome back to Pharma PhD exam. Today I'm continuing the UPSC question paper discussion. So today's first question is, which one of the following antiarrhythmic drug produce brief therapeutic action and transient adverse effect? So from this question we need to see the two major part, that is the brief therapeutic action, that is within a short period it will provide the therapeutic action, and also transient, within a short period also it will produce the adverse effect also. We need to find which one of the drug from this following options. So first option is diltiazem, B is propionine, C is esmolol, and D is adenosine. Before that, we will find out the classification. Okay, in which class these drugs are coming. So this is the classification of antiarrhythmic drugs. So, what is arrhythmia? Arrhythmia is the irregularities in the cardiac rhythm. So the drug we are using for this arrhythmia, call it as antiarrhythmic drugs. Very simple. So class 1 drug is there, class 2 is there, class 3, class 4, and additionally again it is classified for paroxysmal supraventricular tachycardia and also for atrioventricular block. So we will find our drug. So the first option was the diltiazem. Okay, as we know, diltiazem is coming under class 4, that is the calcium channel blocker. The second option was propionine. Okay, this propionine coming under class 1, that is the sodium channel blocker, that is under class 1C. Okay, that is the phase 0. Then next drug is a esmolol. So esmolol is coming under anti-adrenergic agent. This one is esmolol, anti-adrenergic agent, that is the beta blockers. The last option is adenosine. So adenosine is coming under paroxysmal supraventricular tachycardia. So the correct answer for this question is adenosine. I will give the explanation. This answer I have found from Tripathi. So we will check out the dose. That is rapid IV injection, we are giving the adenosine administration. So over 1 to 3 seconds. Okay. So within this it will produce us the action. Okay. The action is terminating within 30 seconds also. Okay, after administering, it is giving action within a seconds, and also it is terminating its action within 30 seconds also. Okay, so again we need to see the metabolism. Okay, adenosine have very short T-half in the blood, that is approximately 10 seconds, because RBC and endothelius is uptaking this drug very fast. Then suddenly it is converting into 5-AMP and also inosine. That is 5-AMP in adenosine monophosphate and converting, and also inosine is forming. Moving its adverse effect. Okay, this is the answer. It is producing transient dyspnea, chest pain, fall in BP, flushing in 30 to 60%, ventricular standstill for few seconds. That is, it is happening within a seconds. The action only lasts for less than 1 minute. The adverse effect, okay, this is the portion, the adverse effect. Okay, the adverse effect, even cardiac arrest may happen. These are transient. That is within a seconds the adverse effect is showing. So മലയാളത്തിൽ പറയുകയാണെങ്കിൽ തെറാപ്യൂട്ടിക് ആക്ഷൻ വെരി ഷോർട്ടാണ്, അതേപോലെ തന്നെ ട്രാൻസിയൻറ്റ് അഡ്വേഴ്സ് ഇഫക്റ്റും വെരി ഷോർട്ട് ടൈമിൽ ഉണ്ടാവുന്നതാണ്. ഓക്കെ, ഇതാണ് ആൻസർ. ദ ആൻസർ ഈസ് adenosine. So moving to the next question, which one of the following statement regarding succimer is most appropriate? The correct answer we need to find. So first option, it produces less toxicity than dimercaprol. It is ineffective orally. Please keep inside the mind the options. And also it is effective in the treatment of iron poisoning. It is contraindicated for use in the child. So this is also answer from the Tripathi. So succimer, it is dimercaptosuccinic acid. Okay, as we know, dimercaprol for poisoning. Okay, we are giving for lead, arsenic, mercury poisoning. So same dimercaprol, it is a derivative of dimercaprol, we can say. So we can say it is a similar to dimercaprol. Okay, the answer, we need to check the answer. It is similar to dimercaprol. Okay, in this answer, it is orally effective saying. Okay, orally effective. But in the option, it is given as ineffective in orally. Okay, so, okay, the second option is wrong. Okay, then moving to the third option, that is giving for iron poisoning. Actually, this succimer is given for arsenic, mercury and lead poisoning. Okay, the last option is contraindication in children. So I have checked the answer in internet also. The succimer is giving to children also. Child dose is also there. So this option, okay, we can say it is wrong. Okay, so this is wrong option. So this is wrong option. This is wrong option. 3 option. Then final we received that as we found that similar action that of the dimercaprol. So the correct answer, and also which is producing very less toxicity as compared to dimercaprol, I referred also about the toxicity of the both the dimercaprol as well as the succimer. So the correct answer is A. Okay. The next, moving to the today's third question. Which one of the following monoclonal antibodies is specific for RANKL and is indicated for treatment of post-menopausal women with osteoporosis? So I will explain about RANKL, what is RANKL, and also the monoclonal antibodies that is given for the treatment. This is one article I received from the PubMed Central. So what does RANKL? RANKL means receptor activator of nuclear factor kappa B ligand. Okay, R means receptor activator, that is of nuclear factor, that is N. K is kappa B ligand. Okay, kappa B ligand. This is RANKL. After menopause in females, there is a bone resorption will happen. That is the destruction of bone tissues will happen. It is this RANKL is a new target that we are finding for the new drug development. So RANKL എന്ന് പറയുന്നത് ഒരു ലിഗാൻഡാണ്. ഈ ലിഗാൻഡിലേക്ക് എന്ത് ചെയ്യുന്നു വെച്ചാൽ മെനോപ്പോസ് കഴിയുമ്പോൾ സ്ത്രീകളിൽ ഒരുപാട് ബോൺ റിസോപ്ഷൻ നടക്കുന്നുണ്ട്. അത് ബോൺ ടിഷ്യൂസ് ഒന്നും ഡിസ്ട്രക്ഷൻ നടക്കുകയാണ്. അപ്പോൾ അതിന് വേണ്ടിയിട്ടൊരു ബെറ്റർ ടാർഗറ്റാണ്, ഇപ്പോഴത്തെ ഒരു നല്ലൊരു ടാർഗറ്റാണ്, നമുക്ക് റിസപ്റ്റർ ടാർഗറ്റ് എന്ന് പറയും ഈ RANKL എന്ന് പറയുന്നത്. സോ വിൽ മൂവ് ടു ദ some of the classifications. Okay, these are the target antigen that the monoclonal antibody is giving. So this is the thing I found from this page, that is the RANK ligand inhibitor. So the drug which is giving is denosumab. Okay, here it is written, here it is in a post-menopausal osteoporosis. Okay, some other drugs are also given in this page, that is monoclonal antibody and their target also. So for example, I'll explain only 1-2 example. Adalimumab, which is an inhibitor of tumor necrosis factor alpha signaling. Okay, TNF factor alpha. So mainly adalimumab is given for autoimmune disorders. So in this from that page also we found that the answer is denosumab. So last question today's video. Which one of the following is mechanism of action of bisphosphonates in the treatment of osteoporosis? The last question, and this question also regarding the osteoporosis only. So we will learn about the bisphosphonates. Okay, so we will discuss the first options first. First option is increasing the osteoid formation. Second one is decreasing the osteoclast mediated bond resorption, increases the mineralization of osteoid, decreasing the parathyroid hormone secretion. So we need to find out the mechanism of action of bisphosphonates. Bisphosphonates, this is the analog of pyrophosphate, which is having the skeleton of POP. Okay, we'll move to the classification part. It is classified into three main categories: first generation, second generation, and third generation. First generation drugs are etidronate, teludronate, and second generation are pamidronate, alendronate, ibandronate. Third generation is resendronate, zolendronate. So this is the basic structure of bisphosphonates. R1, R2 will change. That is, a different group may come. So next, moving to the mechanism part. So in this portion, this says that bisphosphonate will inhibit the bond resorption. So two things I need to show, that osteoblast and osteoclast. Osteoclast means which will breaks the old bone tissue. Okay. Osteoblast means which forms the new bone tissue. Okay. We will check the options one by one. First option is increase in the osteoid formation, decrease in the osteoclast mediated bond resorption. Third is increasing the mineralization of osteoid. Fourth one is decreasing the parathyroid hormone secretion. So we found that which will inhibit the bone resorption. So bone resorption is mediated by actually osteoclast. Okay. So what our drug will do means it will decrease the osteoclast mediated bone resorption. If a patient having osteoporosis, any type of bone cancer, this resorption will be more. Actually, the osteoclast, what the osteoclast do will, as I mentioned earlier, that it will break down the bone tissue. Okay, what will happen means this tissue will release the calcium and will move to the bloodstream. Okay, there is a poor amount of calcium or phosphorus in our body. This type of breakdown, that is the resorption, will happen. Okay, so these are the 4 questions today I have discussed. So study fell for the Kerala PSC drug inspector examination. It will come very fast. We need to thoroughly study all the portion, then only we can crack the exam. I will come with the next video, the next 4 questions. Until, thank you.